I'm Sean, and I am a couple of rad techs, and I am going live today on my YouTube channel. So I hope you guys check in and check it out because I'm going to be answering questions from all of my followers, whether it's TikTok, whether it's YouTube. I got a ton of questions, and we are going to stay live and answer them all. And anything that you all put inside of the chat, I'm going to answer as well. So I am going to just make sure we are all good here and that I can see all of your questions. This is very important. So let me just tell you a little bit about my channel. I am a Radiologic Technology channel, and I talk all things radiology. I make radiology relatable. If you haven't seen any of my content, you definitely want to check it out because I try to be as funny but as real as possible. I just did a video on medical dosimetry, which is a question everybody asks all the time. What are the different professions in our field? So if you have not checked it out, please go ahead and check it out because it is amazing. So let's get right into the questions. And remember, if you all have questions, I've got the chat open. I am never going to miss a question. Let's get into it. So I'm going to open up my share screen and put the first question on the screen. First question is, there we go. How do you respond to disrespect from doctors? That is such a good question. Now, it's not often that I have to deal with disrespect from doctors. We work with radiologists. Those are our doctors. They help us be able to do biopsies and procedures. So sometimes you get, of course, doctors that are not always nice when they ask you to do things, or they get frustrated with maybe your type of imaging, or they just don't know how to talk to people. But most of the time, I really have not had a problem with the radiologist. But we deal with all doctors in hospitals. So I'm just going to start with radiologists. Have I had a run-in with a radiologist before? Yes, I have. And not many, honestly, not many. Radiologists, either they're in their room dictating, you don't really, but there was one, she just did not know how to talk to people. And she dealt with people to try to make them fear her. And that's not how you act. And I worked at this hospital for many years, and she was a bully. I mean, that's the best word I could describe for her. But it turns out she was being bullied by the group of males in her radiology group that she was in. They picked on her because she wasn't confident. She wasn't sure. She second guessed. She couldn't make a decision. Like if she tells you, get her this particular, doing the breast biopsy, get her this or get her that, she's waffling back and forth. She wasn't confident. But, you know, when you're working in that kind of environment with people that pressure you and bother you and make fun of you because you can't make a decision, yeah, you're going to kind of be that way and take it out on other people that you work with who you may feel are below you. So this particular time, I had an MRI, and on the brain, there was something. Now, I can't tell you what it was. I don't want to be as descriptive as, to give anybody a chance to know, but there was something there. I didn't know what it was, but I knew it was. I ruled out other things that it could have been. It was kind of one of those things that after doing MRI for so long, you kind of know the difference between a cyst, a tumor. You even know the difference between benign things and things that are not benign. And, and not always, and we're not there to read, but as technologists with experience, we can kind of tell when, hey, we need to make sure this outpatient does not leave. And that was the case. I want to make sure this patient did not leave. So the dreaded bully radiologist was there, on the only one this evening. And the other techs are like, I'm not calling her. And I was like, we can't let this patient leave. And I can't keep stalling this person because now they're going to know something's wrong. And I wasn't really even sure something was wrong. So I didn't want to get them nervous if it was not anything bad, that they could just go home and enjoy their weekend or whatever it was. So I called her and she goes, what do you want, Chandra? I mean, it's funny now, but it sure wasn't funny then because I knew what she was going to give me and I was already ready. I had the dukes up. I was ready to go. And she says, what do you want, Chandra? And I said, Doctor, I'm calling because I have a hurry up and just talk. I was like, could you check your tone? And she said, hello, welcome. And so she says, I'm busy reading. Okay, but I have a patient here that you need to look at the images. I knew to already send the images over, so she didn't have to wait on the imaging. And she gets, I'll look at it. And she hangs up on me. I didn't didn't get to tell her what the patient's name was or anything. This is the question I'm answering. So I didn't even get a chance to tell her what the patient's name was. And I called her back because now I'm irritated because you hung up on me. And she goes, Chandria, what do you want? I told you, I said what I wanted was to give you the patient's name. The patient is here and I cannot stall them anymore. I need you to look and I'll call you back. So what's the patient's name? I gave her the name, gave her the date of birth. She hung up on me again. This time I didn't call her back because I gave her what I needed. Lo and behold, what does she do? She lets me sit there for a long time. Well, by this time, the patient is getting antsy. I can't lie to him anymore. I said, well, I just sent your things over to the radiologist because there was something and I just don't know what it was. So I wouldn't worry, but the doctor's looking. And so the person's like, look, why did you send my stuff? So I don't know what it is. Okay, so hang tight. They were like, okay. So I went into the radiologist's room because I'm like, if she leaves without giving me an answer, because sometimes what doctors will do is, I tried to call you, you didn't answer. They never call you and tell you the patient can leave. They just want to beat that traffic and get out of there, and they know it's nothing wrong, but they don't call you and tell you there's something that is not, that is not bad. The patient can leave, and they just forget to call you. Well, you're sitting there waiting. I waited for an hour one time when the doctor forgot to tell me the patient can leave. It was so annoying. So I just went on into the radiologist's dark room in their reading room and I knocked on the door and she didn't answer. She didn't say hello. She didn't say anything. And I was like, I opened the door and I peeked my head in and I said, were you ever going to call me? The patient is annoyed now. They're ready to go to administration. She didn't want to hear that. She didn't want to hear that because now if the patient goes to administration, they can file a complaint and you just don't want that. I was still reading. I wasn't done. I mean, just give me a second. That's fine. I can wait right here. I closed the door and I stood in that room with her and I waited. That way I'm not going back to that patient and waiting on you to call us again. Not happening because obviously you don't call this a priority. So she looks at it. I'll call you. I'm going to call you right now. Just let me read it. I'll call you right. Okay. I will come back. She saw it on my face. I will come back. So I went on back, told the patient she's going to call us. She did call. Okay, Chandria. Yeah. It wasn't anything bad, but the patient did need to go see a doctor. She needed to call it in to a doctor, and for the patient to see their doctor the next day. So it wasn't anything where they needed to go to the ER right then. So she came and spoke with the patient and explained to them, what she saw, but they needed to talk to their doctor, but not to worry. So did she say thank you? No. Was I expecting it? No. But yeah, so that's one of the things. That's how I personally handle disrespectful doctors. I don't care who it is. And I have not had many in my profession. I'll be honest. I only had one more when I was a student and I never went back to the OR after that. The OR and me as surgeons just usually don't mix. Some surgeons, but it just depends on the type of surgeons. Each doctor has a personality, you guys. Each type of doctor has a personality. So you have to learn that. And some people just don't jive well together. But I have not really had bad experiences with doctors, honestly. So, I mean, other people may have, but I have not. But how you deal with them is you set boundaries still. You have rights and they have to follow protocol in hospitals as well. Doctors can't mistreat you and harass you and call you out of your name and talk to you in a kind of way. You will rarely find it. Maybe they do it to each other. And they do, you got rude people everywhere, but you're still their coworker. So they cannot treat you like that. And you're okay to file a complaint with them. So yeah. So hopefully that was it. If you guys got any other questions, I'm going to go to the next question or statement that I got. Let's see. I hit the wrong button. I hit add a person. So here is the next one I got. I'm answering questions from TikTok and from my comments here. And in 20 minutes, you guys are going to hear, actually in 10 minutes, I'm going to get a phone call from a student in one of the radiology programs that wants to interview me for her program. So I'm going to do that live on this restream. I'm going to go live with this interview. It's going to be a phone interview. And you guys are going to be right there listening. So hopefully her questions will answer some of your questions. Yafet says, hey, I've been watching for a long time. Thank you for all the advice. Yafet, thank you so much for watching. I really appreciate it. I am trying to be more consistent on YouTube. And definitely trying to do more live streams, because I feel like the live streams really are more intimate and people can really ask the questions and express themselves and not just ask one question. You guys can ask a question, I can answer right then. You can think of another question, or maybe what I say jogs your memory, makes you want to ask another question, or you have a set of questions. So this is why lives are really good. So be sure to set your notifications. I'm going to go live at least Mondays and Fridays. That's going to be my live days. And if not Monday, Friday, Monday, Thursday, something, in the beginning and the end. We're snowed in. So finally the snow's kind of melted, but we got ice. So here's my next statement or comment. It's kind of close to Yapis. I appreciate people that support my channel, my podcast, my content. So Lily says, thank you for all your videos. My son is pursuing a career in radiology and you have been so very helpful and I can't thank you enough. That was really nice, because that is one of the reasons why I create this content, because people don't know that this profession is out there. And when they do hear about it, I was on a Reddit post the other day with a group of nurses and I was just shocked at the lies that were being told about our profession by nurses. And I'm thinking, I can't come on here and tell you the life of a nurse, day in the life, even though my grandmother, my two aunts, my cousin are nurses. I can't tell you the day in the life of a nurse because I'm not one. And I would never try to do that. I would never try to degrade another profession just because maybe I'm scared that they're taking all our people. I mean, that's all I could think of, because on this Reddit thread, someone asked, they were waffling between radiology and nursing, but they weren't sure. So the nurses, well, this particular nurse came in and said, don't choose radiology, don't choose X-ray is what they said. Don't choose X-ray because you don't have options in X-ray. They don't make a lot of money. I mean, just went on and on and on. And I'm thinking, options. I've been in it 22 years and I've done radiology, general radiology. I've done CT, MRI, a little bit of mammography, screening mammos. I've done teaching. I've been in leadership and chose not to continue. And I chose not to continue teaching, but I've done those things. I've done clinical applications, which is similar to like traveling sales reps. So you go around when someone sells a machine, an MRI machine or a CT machine to a vendor, like a hospital, I go in and teach the staff how to use it, put in protocols, those type of things. I've also been a consultant where I actually put together things for facilities, getting them certified and licensed and approved for their licensure and setting up their facilities. I've done that kind of stuff before. There's so much. There's so many things. And now I'm doing social media content because of all of my experience. So, and I'm thinking about going into either medical dosimetry, radiation therapy, or informatics. I don't know which one, you guys. I mean, there are so many options out there. And this comment from Lily is something that I love doing, is going into schools and showing younger people as early as possible how they can get a career or something that can still allow them to take care of themselves while enjoying passion. Some people don't want to go to school for years and years and years. They want to get something that's a few-year degree, maybe a bachelor's degree, associate's degree, have something where they work maybe 3-4 days a week and they can do something else. Makes sense to me. So Yapit says, tomorrow I have an in-person interview for an MRI tech assistant position. Do you have any advice for me? I want to impress my interviewer. First piece of advice, and congratulations on your interview. Very good. Yeah. I find that very interesting. MRI tech assistants back in the day, many, many moons ago, in my area, we don't have tech assistants really anymore. It is very rare that they exist. We used to have them all the time at CT and MR. I mean, you need tech assistants in these busy departments. And I appreciate a hospital that still hires tech assistants, because trying to scan patients as well as, should have refilled my water. This is my gift from the Radiology Tech Week from the ASRT, you guys. Yeah. That's one of the benefits of being a radiologic technologist. You get to join the ASRT and we get gifts every year. So my advice to you is be yourself. Show how you can be an asset to the MRI department. Make sure you let them know you follow rules. MRI is so important that you follow rules, period, but especially in MRI. Why? Because you have so many rules to keep everybody safe inside of MRI. You want to make sure you're somebody that follows directions. Let them see and understand that you follow directions. You don't try to take um, shortcuts through things, because when you try to take shortcuts, if you're a tech assistant, you're going to be responsible for bringing patients into the MRI department, getting them screened properly, making sure they pass the screening. The technologists are relying on you. Show them in their interview that you can be trusted and relied on, and that technologists don't have to check behind you. They won't have to come in. Once you learn how to do the job, the technologists will not have to come behind you, and you don't plan on making it. Give them examples of how you cross-check and how you have systems maybe in your everyday life or in your past job. Just show them how responsible you are. MRI has also very scary patients. The people they come in very claustrophobic. They might not come in claustrophobic that you see, and then all of a sudden they freak out, and you're going to be the first person that comes into contact with people. So how you treat them, calm them before they get to the technologist, that is going to make a world of difference. Really build up your people skills and talk about how much of a people person you are, how you just make people feel relaxed, and give them an example of when you've done that. That's going to be huge. That is going to be really big for them to be able to see what an asset you are to the department, because you need that. You need someone who can come in and just make it happen. Technologists, all they got to do is scan, look over the paperwork, and that kind of stuff like that. I mean, that's going to be really, really important. I was charging my phone because I have this call in 4 minutes, but we're going to do another question. Thank you, Yapet. And let us know, come back to a video or my comments, and please let us know when you get the job, okay? Because I know you're going to get it. So I have another question here. This is really good. We got any introverts watching, or if you're watching a replay, introverts? I get this question a lot. And the question asks, how much collaboration do you do on a day-to-day basis? They are an introverted person. So someone who's introverted usually kind of stays to themselves. They don't really need or like to be around a whole lot of people. And that's okay. But I will say in medical imaging as a whole, all of the modalities, except ones that are not direct patient care, you can be an introvert. But, and it's a caveat to that, there are professions like medical dosimetry where you don't deal with patients. You just deal with calculations and computers, but you do still have to collaborate with coworkers. You're dealing in close quarters with the not the cardiologist, the oncologist, the radiation oncologist, the physicist, the radiation therapist. You are working with a team of people. So you can't escape people in medical imaging. Healthcare, you just can't escape people. You're going to have to deal with people. How much can you? Each person is different. How much do you really want to deal with people would determine which profession might be best for you. Hopefully that's helpful. Hopefully that makes sense to you. Yeah, let me know what makes sense to you. Let's see. Okay, let me go get my phone because I want to make sure that I don't miss this call. But let me pull up another question just in case she doesn't call yet. But you guys are going to be on a live interview with me. So this is our next question or comment. Let's see. This is a lot of fun. I'm going to have to do this more often. Okay, I got another juice. I used one of the big ones, big chargers. Okay, I had it on airplane mode. Hope she wasn't trying to call. Okay, let's see. You guys are going to be on this call with me. Okay, so she hadn't called yet so far. Let's see. Okay, I'm going to turn my volume up. Get that there. So when she calls, we can go. Okay, so next question. I'm thinking about this field, speaking of radiology, how risky is the exposure to radiation? Does it lead to cancer? So no, you have safety measures put in place when you go to school for radiologic technology. You learn radiation safety, right? So you're not just going to be allowed to press buttons. That's not going to happen. You actually take a whole course on radiation biology, pathology, all of those things. So you're going to be ready to calculate dosage. We also have, when you're doing machines, all the machines have certain built-in parameters where you cannot over radiate someone. And when you learn the parameters of and the safety measurements of, the safety of radiation, you learn that the amount of radiation that we give patients is so minimal compared. Oh, there we go. Let's go live. Hello.
Hi, how are you?
I'm good. How are you doing?
I'm doing great. I do apologize for the raspy voice. I ended up getting the flu here.
Oh no, that is totally okay. That is totally okay. I was doing a live while you were waiting on you to call. So if you don't mind being on my live while I answer your questions, I'll just incorporate it into my live.
Oh, how can you do that?
Oh yeah, the live is, I got it playing right now, so just through my speakerphone. So yeah, I would gladly answer the questions, and that way you have, because I read it and it said you needed to talk to me over the phone or to do it over video. So I was like, let's make sure we do this video right.
Yes, that's perfect. So I don't want to take too much of your time because I know you have a live. So I have about 6 questions, which is, pertaining to the position that I'll be. I'm currently taking classes at Miami-Dade. I'm in Miami, Florida.
Okay.
And I'm a radiography major. And we have to ask a couple questions corresponding to the position that we look forward to being in the future.
Great. Okay. And by the way, I'm from South Florida. That's so funny that you're in school down there.
Really?
Yeah, I was coming down this week before the snowstorm hit us. But I'm always down there in Miami and Fort Lauderdale. My family's in both.
I'm from the Miami Gardens area.
Yep. I'm coming to Captain Crabs when I come down there. So I'll be in your neck of the woods.
Yeah, they're really good. Okay. I don't know how to start.
Oh, go ahead. You're first. I think you're first one. So it says identify a health profession. How would they describe a typical day at work? That's what I have on here on the first one.
Yes.
So for me, a typical day, I do 3 modalities. I went to school for radiologic technology, and then I actually went to get certified and learn how to be a CT technologist. And then a couple years later, I went and learned how to be an MRI technologist. So my day, I can do all of them. And the main 2 that I still work in are CT and MRI. So I'll tell you a day in the life of an MRI tech because I don't do Xray anymore. But I could tell you the day in the life of whichever one you want me to tell you.
I would like the day in the life of the MRI and the CT, and I want to know why don't you do that anymore?
Okay, so I don't do radiology diagnostic X-ray anymore because when I went to school, I learned all of these other modalities were out there. And I said to myself, wow, I have an option to start here at diagnostic X-ray, but I also have the option to do at that time, it wasn't 11. It was maybe 8 other modalities. MRI wasn't that big then. It wasn't that big. So MRI wasn't even on my radar. But I knew I had CT, radiation therapy. I had heard of medical dosimetry, nuclear medicine, and ultrasound. I said, wow, I need to go ahead and learn these other ones. And so that was always my goal, was to go beyond the beginning of where I started. It wasn't because I didn't like radiology. I actually just went into I was looking for some stuff and I found an award I won at school. It was the most outstanding student award. I finished all of my clinics in radiology in 1 year instead of 2 years. All the clinicals that we have to do, I did them all in 1 year instead of 2. So I really loved radiology, but I knew that there was more out there for me to advance, which meant more money, more flexibility when it came to options in the career path. And that's what I've had. So my second year, I rotated through every modality in school to figure out which one did I want to do. and radiation therapy was it, but they didn't accept me when I applied. So CT and interventional radiology offered me a job. Interventional radiology was amazing, but they take call that is absolutely too much for me. I don't like to take call like that. But you make really good money, and interventional is really cool. I enjoyed myself in that department, but I don't want to take that kind of call. If call is for you, it's a great profession. CT was it, and I really enjoyed CT. The machines were a lot slower then. We had to do a lot of math and calculations. Now things are a lot faster. I did so on a day-to-day life in CT. When I go in, I have to go in to calibrate the machines because it is a radiation. That one has radiation. You have to calibrate the machines, which turn them on, do QA checks. You have to make sure that all the cylinders and beams are all firing properly and there's no malfunction before you put a patient in. So you have to run certain QA tests. You have to make sure all the buttons and everything. You have to fill out a log form to show that you actually did all of these QA checks.
Yeah.
And you get your patients ready, bring your patients back. Now in CT, some patients get IV contrast, so you have to know how to put in IV. So I get all my IV supplies, make sure everything's available for the day. If I have my patient log ready of how many patients I have, and I get everything ready. Some of my patients also have to drink contrast, so oral contrast. It could be the chalky contrast or a clear one. And the difference is the clear one is what a lot of places like to use, because if a person has a perforation of their bowel, like a hole in the bowel area, and it's leaking out, it doesn't, the clear one just is water soluble. The chalky one can cause a problem. So, but you have to know the difference between all of those things, and you learn that as you go. So you can also some days be assigned to biopsies in CT. So some days I am working with the radiologist and another technologist, and we are working where we have to get pieces of tissue, say out of the kidney. So you have to work with the radiologist, operate the machine, and one is in a room in a sterile field, and we have to assist him or her to remove pieces of tissue out of whatever organ they're trying to get through live video through the CT scanner. And we do that. It can be quick, it can be very long. And yeah, so that's what a day kind of looks like. Or you can work in the emergency room in CT, which is hopping. I mean, CT, you're going to be busy. It's a busy day. Each scan maybe lasts 30 seconds. The longest CT scan probably is a minute or two.
Okay, that's not really long.
No, CT is not. I've done around 60 patients in one day, in an 8 or 10 hour day in CT. Yeah, CT is busy. But it really, you either love it or you don't love it. I loved it. MRI is slower, but I wouldn't say MRI is slow. So you do similar things with CT and MRI. Both deal with cross-sectional anatomy. So all of your anatomy, CT is 2D and MRI is 3D. So that's the difference. And one uses radiation, one does not use radiation. Well, ionizing radiation.
Okay.
CT uses the ionizing radiation like radiology. MRI uses radiation and radio waves. That's the difference, radio waves. So it uses the hydrogen in your body along with radio waves, the magnet, and the radio waves and the hydrogen in your body. So it's a different thing that you learn in MRI than what you learned in radiology. Two different principles, but it's a very good detail of an image. So the same days when I come in for MRI, depends on if I work in a hospital or outpatient, you still have to make sure you do the QA of your machine, because this machine has to be working before you stick a patient in it. You got to check off into your logs on if the machine is working. And you also do contrast. We give contrast. It's a different kind of contrast. It's a heavy metal contrast, and you don't use a lot of it. Some patients get the contrast. And what that does, it helps doctors rule out infection. So you have to be good at putting in IVs for MRI as well. You get a lot of practice. They drink contrast for some MRIs as well. We have enterographies, certain abdominal exams where they have to drink a certain kind of contrast, and then you lay them on the scanner and you look. It's usually for like Crohn's and things like that. Specifically for Crohn's, it's really a detailed image. MRI is very good for detail. Very, very good for detail. When you know there's a problem, you go to MRI to get the better detail on it. So that's how that works. And you can do biopsies. I do breast biopsies. We do breast MRIs as well. So some days I'm assigned to breast biopsies with the doctors, and we That can be long. And in some places where we do cardiac scans, so we scan hearts and we scan people with pacemakers now. Some pacemakers are safe.
Okay.
Yeah. So we can have patients come in, but we have to get it all cleared, have a whole team ready just in case. They just can't walk in with a pacemaker and turn it off and get it done. We usually have to have a cardiology team on notice that we have a patient coming in that's going to turn their pacemaker off for us to do the
Yeah.
scan. So, when you turn them off, it always is dangerous. So you have to have certain parameters in place. But we do them pretty regularly. So it's not looked upon as very dangerous anymore when we have MRI safe, compatible pacemakers. And that's pretty much the
Okay.
day. It can be very fast paced, but it's that's pretty much a day in the life. And then you clean up, you take the laundry out for both because you got plenty of laundry, and you disinfect really well. We
Mhm.
usually disinfect in between patients, but you really disinfect deeply when you have people that vomit on the table. We do get patients that vomit on both CT and MRI with the contrast. Yeah, patients can vomit, so you have to clean that up. I've had some really bad situations where I had to call EBS in to
Mhm.
come clean up. So you do have those things. We don't do a job where you just press buttons. You have people that unfortunately have reactions to the contrast and they can pass away.
Wow.
Emergency situations happen in MRI and CT, so you have to always be focused on your job and realize that what you're doing, could be dangerous. It could start out really
Mhm.
simple and well, but totally take a turn.
Yes. I can definitely hear that, and I've seen, like videos. I watched Residency on Netflix. I don't know if you know about that show, The
Oh,
Resident.
yeah.
Yeah, I watch that show a lot, and I do see, like, like a little insight. Although it says don't believe anything you see on TV, that's what honestly draw me to, go back to school and invest my time into becoming something that I honestly desire to be. And you stated that MRI was one of your favorite modalities that you chose.
Well, it was one that I chose because I was doing CT for so long and I worked contract for a very long time. So a lot of times when you work contract, you get the second shift, the weekends. So
Mhm.
after a while, I was like, this is going to wear on my body. I need to be smarter and get another certification. And let me look at something
Mhm.
that's not as rough on my body. And so that's when I said, well, it's easier to cross right over to MRI because it's the same principles cross sectional wise. I just have to learn the physics principles of it. And that's how I got into MRI because it was an easier crossover coming from cross sectional CT to cross sectional MRI. And it
Mm.
made more sense for me because it made me more marketable. And that's why I talk a lot about students when you're in school for radiology, be strategic about what certifications you're going to go from. If you start at radiology, which I suggest, it opens you up to be able to choose from over 11 modalities by just adding maybe 1 year of schooling versus just go for MRI. That's all you could do. So
Mhm.
for me, strategically, I went from radiation, which is radiology, to a radiation-based program, which is CT. Same principles. I didn't have to relearn any book stuff. I just had to learn cross-sectional. So it was an easy transition. I passed that ART exam very easily because I already passed the ART Xray one. They were the same one, except one had cross-sectional. So now when I went to MRI, the only thing I needed to learn over there was the physics principle that wasn't radiation. I already knew the cross-sectional part. That was an easy breeze. So now when I go find jobs or I get people that want to hire me, they say, wow, she can do two things, CT and MRI. And imaging centers usually have a
Mhm.
CT scanner and an MRI scanner. So they'll pay me more money instead of paying two technologists. Now I'm not
Yeah.
scanning at the same time, CT and MRI, but it gives me options to make more money because they can hire one person to do two people's job.
Yes, which is really good. So you're pretty much killing two birds at one stone. You're advancing your knowledge, and you're pretty much making the job work for you. You're not killing yourself.
Exactly.
That's good. That's all I think. Okay. And I want to say on one question. My other question is, what do you find most rewarding about working as an RT, or as I may say, MRI or CT?
The most rewarding part for me is the experiences I've had. I've met so many really, really good patients. And I'm so many people I worked with over the 22 years. I've met some really knowledgeable and smart, good people that I'm still very close to this day that I've worked with. Um, but yeah, and just that this career has been able to allow me and my husband to have the freedom of time to be able to have fun. We like to travel. So we don't
Mhm.
have to work Monday through Friday and only have to live for the weekend because
Mhm.
of what we know how to do and the type of employment we have. We can work 312s, we can work 410s, and every week have a long weekend. You know, that's a blessing in itself. For me, I appreciate that I'm able to work contract, which allowed me to be able to take care of my father until he passed away. I have flexibility in my schedule. Um, you know, there are just personal things for me that having this job has allowed me to be able to do.
Okay. Okay. Yeah, I'm typing as you're speaking.
Oh yeah,
So
no
pretty
problem.
much, so pretty much getting into this field gave you the work-life balance that you always desired. Because I completely understand the 312s and the 410s. Because right now I'm a manager and I work 5 days out of the week and I work 10 hours straight,
Wow.
and it can be very taxing. So having that kind of work-life balance to not just, invest in yourself, like spend time with families is very important, especially since we're like humans. We do want to break as well. So I like the fact that you said work-life balance and networking. Do you like move around a lot? Are you like a travel CT, MRI radiologist?
Yeah, as a radiologic technologist, I still do. I do travel. So I just finished one contract, and I'm looking to find another one now. I gave myself a couple months off because I have worked nonstop since the pandemic, nonstop, and I was like, you know
Mm-hmm.
what? I'm tired.
Mm-hmm.
I am tired. So yeah, and I used to work full time, and I was in management, and I came to a realization that I don't need to work a Monday through Friday permanent job. I can do better for myself working PRN. And that's when I started going PRN. I like PRN. I love PRN. I've been doing it for many years, and I can't tell you the last time I worked full time for anyone. And I just find that, it gives me the flexibility that, and this that's something we have an option. And I have been a traveler before, but I do more contract work since the pandemic. I do more contract work, which is local. I don't go out of state as much, but we have so much need local that I don't have to go out of state like I used to.
Yes. Okay. Local. And I just want to ask two more questions.
Oh yeah.
And wait, no, okay. Mm, so I know you started off as a radiologic technician, and then you
Technologist.
went into technology
Technologist, yeah.
technologist, and then you went into CT and then MRI. What do you think sets radiology apart from other medical specialties?
Ooh, that's good because when I started, okay, so for me, I've never done any other medical job before, but I did start out in respiratory therapy shadowing because I thought that's what I wanted to do. And I realized when I was shadowing, I don't like mucus. I don't like to hear snot. And I was like, I cannot hear this every day, all day. No, I knew that was
Yeah.
not for me. And you have to be honest with yourself what you don't want to deal with and what you don't like. And I didn't know until I shadow. I really feel like people should shadow imaging and really shadow whatever profession you want to be in, like a for real shadow. Just don't walk around and sit in an outpatient lab with somebody. Go into somewhere and go somewhere where it's like the roughest place and really see the nitty gritty. For me, um, ask your question one more time. I want to make sure I get the full answer because it's
Yes. I asked, what do you think sets
yeah.
radiology apart from other medical specialties?
And that's what I say. I just want to make sure, because I don't like to say we're better, because this is all I know. But what for me, why I think it is a wonderful profession, and I can't say it's better than another, but what sets it apart is we're growing. And I think in the 22 years that I've done radiology, I look at how far CT has come. We used to have a calculator out and measure, and the machines weren't faster than the injectors. So a lot of things we probably didn't have good bolus tracking on. So the diagnosis on the people probably wasn't 100% right. There was a lot of guessing in the early days. And technology has come so far. And with imaging, I can only imagine how much further it's going to come. Especially, you look at now PET radiology exists. That didn't exist. And there's a shortage for it. And they make a lot of money. Medical dosimetry is growing, and AI is helping. A lot of people don't know about medical dosimetry. And people don't know that we do more than X-rays. And that sets us apart, because you have nursing and everybody's a nurse. You have respiratory therapy and everybody's a respiratory therapist. But in medical imaging, everybody is not a medical imager. I mean, we are, but we're radiologic technologists. We're MRI technologists. We're radiation therapists. We're medical dosimetrists. We're radiologist assistants. I mean, there are so many different facets to our profession within our profession, if that makes sense. So for me,
it makes perfect sense.
Yeah, when people say there's a ceiling in our profession, or they feel like they can't grow, or you're not going to grow in radiology, I really don't know what profession they're talking about, because I still got another 20 years probably to work. I don't foresee myself being able to retire like I want to. I mean, and this job is a job. That's the other thing that sets us apart. You will find people still scanning and working in radiology in their 70s, and you would be shocked these people are in their 70s.
Yes.
It doesn't break your body down like other healthcare professions. So I hope that answers your question. Those are the two I'll say.
Yes, I love the fact that you said, you pretty much stated radiology is a evolving field with addition to the machines, because back then, I highly believe that a lot of people used to guess, just make hypothetical, guessings and stuff like that. And now that we have these machines that can make the accurate diagnosis and stuff like that, it makes radiology completely different from how it was before. And you said it's PET CT. I too didn't know there was like a PET CT either. And another thing you stated was RN. To be honest, being here in Miami, Florida, all I ever see is nurses.
Yeah.
The nurses, CNAs, just nurse. I wholeheartedly didn't even think about radiography until, like I told you, I saw The Residency, the show on Netflix.
Oh, yeah.
And I was just like, and there's more in the medical field that I can honestly get into. It doesn't have to necessarily be nursing. Pretty much what I see every day, especially growing up in the Haitian community, all I see is nurses. Yeah. So I love the fact that you said that radiology is a growing field that a lot of people underestimate. I'm sorry.
Oh, you're fine. Yeah, we are underestimated. The good thing about it is, I'm with you. I grew up with everybody in my family and around me being a nurse. And turned out I have a cousin that was a radiologic technologist. He became a director. I got one of my early jobs under his leadership. He taught me so much. But growing up, I'm like, how did I not know you did this? He wore scrubs, but I didn't know. I just assumed he was a nurse. So it's important for me. That's why I talk to all of my friends' kids about radiology. Like, what do you want to be when you grow up? And they're like, I don't know. Well, let me tell you, have you ever thought about radiology? Because I know the freedom it gives you. And I have over 5 young people who are my friends' kids who graduated, and they're doing either ultrasound, MRI, radiology. They love it. Mammography, they love it. My high school Spanish teacher found out that I went to school for radiology, and she told her daughter. Her daughter went to the same school I went to.
Wow.
She said, I told my daughter because I saw you go there. I mean, you just never know what people are watching and the information you can share with people about something so small. Sometimes people just don't know what they want to be, they don't know what's
Mhm.
out there. And sometimes if you just know, you say, well, let me go look at it. Oh, this is pretty neat. I can do that for 2 years. And then they learn all the other stuff that comes with it.
Yes, yes, that is so true. And I don't know if I have one more question to ask.
Yeah, go ahead.
My last question is, what advice will you give to me as a radiographer? I'm currently majoring in radiography, entering this profession.
What advice would I give you? I would give you the advice to start with radiologic technology first, go to school for that first, and keep your head down and get everything you need to get done as soon as you can get your clinicals done. And then rotate. If you could find a school that allows you to graduate with a certification, go to that school. South Florida has a lot of schools, a lot of options for schools. I would apply to every school that you think you can afford, that you can easily drive to without it being a hardship on you. I would apply to every school that you can. And then you can choose which one you want. That's the thing to me. If you got 5 schools around you, but you really got only one that you really want to go to, apply to all 5. And then when 3 come back, you may say, oh, now I can choose. They're not choosing me, I'm choosing them.
Mm-hmm.
That's what I would say. And make sure when you're in school, you try to get around to as many modalities as you can and get to know people. When you're in school, network. Be nice. Just get to know directors. Don't be afraid to go up to the directors and introduce yourself. Before I graduated, I had different directors asking me from different clinical sites to come take a job over their clinical
Mm-hmm.
site. And I still stayed in contact with those people years later. They helped me get jobs and connections. You just never can not network enough. I just believe while you're a student, make sure you network and get to know people, show your skills off in school, your personality. Um, get all the experience you can get. Don't be afraid to work as a student. I see a lot of people, I know it's for likes and stuff, that post that I can't believe I'm going to school. I'm going to clinics and they're not paying me. I'm gonna tell you, you don't go to any school and somebody pays you to go to school. I mean, that just is not going to happen. You pay for your education and you get what you get out of it. And this is a really good profession. It's a very small profession. Everybody knows everybody in radiology from coast to coast. I promise you. I promise you. People know each other, and a lot of people are related in this field.
Yeah.
So I say that to say, just focus in and do what you do, get what you need to get, and get out and keep going. Get out. I would say too, some people are stuck on they should get a bachelor's, only get a bachelor's, it's going to set you apart. This is my thing. Go to the school you want to go to, but right now the minimum requirement is an associate's degree. If that's what you can get into it. Once you finish, get your employer to pay for your bachelor's. I do encourage you to get your bachelor's, but don't not go to a school just because they don't offer a bachelor's degree.
Okay.
You won't get paid more to have a bachelor's degree in radiology, in medical imaging. You're going to have to get the experience along with that degree. I'm going to tell you that. So go to whatever school takes you that works for you, and then have your employer pay you for your bachelor's. But I would encourage get the bachelor's.
So it could pretty much be like an incentive.
Yeah, whatever job you get, make sure they offer tuition reimbursement.
Okay.
And that's what I tell people, when you negotiate your salary, when you take a job, don't just negotiate your salary. You need to negotiate if you're going to take call or not. Somebody put in the comments they do not want to do our job because they think we all take call. I rarely took call. I only had 2 jobs where they required me to take call, and I let them know up front, I'll take 1 day a month or I'll take 1 day a week. I didn't do a lot of calls because I know once I'm in my house and I go to sleep, I don't hear my phone. So once I'm asleep, I'm asleep. So, I just knew for me that that wasn't negotiable. But you can negotiate those things into your contract, into either you take it or you leave it. And they're going to tell you what they require. So when you negotiate, don't just negotiate money because you can go somewhere and make a lot of money, but your insurance is terrible. And you're paying all that money to pay for insurance that they paying you extra in your salary. Whereas if you go to a job that pays you maybe a little less, but they pay for your whole education, your kids can go to their school for free because some hospitals are attached to universities. So your kids get free education, your mate get free education, you get free education or a discount. It's so many options.
Yes, I like the fact that you said wherever I decide to go in the, in terms of radiography, CT, make sure they offer tuition reimbursement. I never knew the medical field offered tuition reimbursement.
Yeah, it's a job. So your employer, most employers offer it, especially bigger employees, but most people don't take advantage of it. Yeah, it's like 401k. Not all companies. So if you take a job with a company and they say we're going to pay you $50 an hour, but they don't match your 401k. But this other company says we're going to pay you $42 an hour. You get tuition reimbursement, you got good insurance, and we're going to match you for 3 or 4%. Which one would you take? I'm gonna take the one that's gonna match me, especially depending on where I'm at in life. And I'm gonna try to max out it because that's tax-free money over there.
Yes, it is. That is.
It's tax-free versus I'm sitting here making more money and getting taxed on it. So I'm really not making more money. And then I got to pay for my own education out of that more money they're giving me, which is only a few dollars more. You got to negotiate all that stuff.
I like it. You're giving me all the key, the good pointers, like things that I didn't know, things that are like honestly intriguing me. That's going to make me do more research, and I'm just like, wow, I didn't think it would be this simple, but it's just so much, and I'm just hungry to know more as well.
Oh yeah. Well, when do you apply for your program at Miami-Dade?
So right now, I already have my bachelor's in criminal justice.
Okay.
So I'm currently taking my prereqs. This is my first semester back in school as a 28-year-old.
That's good. That is excellent.
So I'm currently taking my prereqs, which is biology, introduction to healthcare. And next semester, I'll be taking biology too.
Oh, nice. Okay, and that should be all of them.
To radiography.
Okay, that should be all of them, right?
Yes, and I'm pretty much going to miss the application due date for this semester, so I have to apply 2026 because I honestly didn't want to rush. Like the advisor was like, "Oh, you could take the mini term." I was like, "Listen, this is my first time back in school. I'm not going to rush it."
Yeah.
I'm doing what I got to do.
Yeah, those taking a lot of hard classes at once. You want to get the highest grades, and this is my advice to you. Now that you already have a bachelor's, so you have a bachelor's in administration or a bachelor's in science?
Bachelor's of Science.
Okay, so when you get this associate's in radiology, after that, get a master's in something.
Okay.
That's my advice to you. Since you already had a bachelor's in science, get your radiology degree. That'll give you your associate's, your bachelor's, and you don't need another bachelor's. I would get a master's in science, a master's. You can go for dosimetry, a master's in dosimetry, medical dosimetry. And make sure you strategically do everything because you already got that bachelor's. You don't need another bachelor's. Don't have 2 bachelors. Get that master's after that. So you make your employer pay for your master's.
Okay. Thank you so much. That's some really good stuff. Like, thank you. I would definitely stay in touch with you.
Yes.
More questions.
Please do. I appreciate.
I don't want to take so much of your time, but it's just like I have so much questions. By the grace of God, I have your Instagram because I no longer have TikTok. I deleted it.
Oh, okay. Yeah, they told us they were going. I don't really get on there any much. It was, to me, it was like too much back and forth. And I'm like, you know what? I have a life. That's too much back
Yeah.
and forth. So fortunately, I took all of my stuff off ahead of time because in 2020 when they were talking about banning it, I said, well, I'm gonna just go ahead and grab all. I downloaded all my videos and stuff. Um, so yeah, definitely stay in touch. Let me know if you have any questions. You know, you can always come in the comments. You can message me on Instagram. You know, if I can help you, I will help you. You know, that's just if I can help you, I will.
Yes. Thank you so much. Thank you so much for giving me 30 minutes of your time. I really do appreciate it.
Oh,
Because I
thank
know how
you.
busy you guys can be. I was like praying. I was like, I hope somebody responds, and by the grace of God, you responded.
Oh
Thank
yeah,
you so much.
it went to a side message, but we got snowed in, and I was like, I need to do this video for her. But I was like, wait, it said she need to interview me. I said, no, let me make sure she get credit for this. So let's do it the right way.
Thank you. And Moon, can I have your first name?
Sean, Chaun.
Thank you so much, Sean.
You're
Thank you
welcome.
so
And
much.
how do you pronounce your name?
Maquisha.
Okay, okay. I said that, but I think I changed it a little bit. I changed it a little bit. So I said, let me ask you how to say it right. And when I come to Captain Crab's Takeaway, because I always come there when I come to Miami Gardens, I'll let you know.
Thank you. Show videos, show the best seafood you like to eat, because I love me some seafood boil.
Oh yeah. Well, see, I grew up on Captain Crab's because I'm from down there. So I grew up on Captain Crab's before they only had the one left in Miami Gardens. That's the only one left. So I grew up on all of that. So yeah, I'm a South Floridian originally. So I love to go back home. All my family's still there. I go back home a lot. So when I come down, I always go to Captain Crab's. So I have to look you up when I come down.
All right. Thank you so much.
Thank you. Thank you so much. And definitely keep in touch, please.
I would definitely do that.
Okay. Have a good one. I hope you feel better.
Thank you.
Okay. Bye-bye. So that was our live interview, you guys. I was interviewed by a prospective student wanting to go to radiology school and applying to the Miami-Dade program. And that was really nice. She asked some really good questions. I hope you all could hear, and I hope you all could really appreciate the questions she asked. And you guys asked some really good questions in the chat as well. That was really, really good. I enjoyed that. I like being interviewed by people. I actually just did a phone interview with a blogger. They were interested in women entrepreneurs and they wanted to know all about radiology. So I talked to them about that. So yeah, so let's get back into these questions. I should have brought some water in here because my throat is so dry. But we're gonna go for it. If you guys have any questions, go ahead and ask them. We've got this comment, which is easier, looking to transition and currently working at urgent care 3 days a week. So I'm not sure what they mean, which is easier. But I guess they're wondering, is working in an urgent care or a hospital easier in radiology? I don't know. Because when I worked in outpatient, maybe only a handful of times has it been just not busy at all. But when it's busy, it's busy. And I've always been busier in outpatient settings personally. I don't know about you all. Um, I don't know about you guys, but I have always felt that outpatient was busier than the hospital. Hospital, you can kind of call your patients when you want them in and out. You know, I can kind of pace my patients in the hospital, unless it's an ER, then you got to clean your table off. And outpatients in the hospital. But other than that, you kind of got your schedule. You got multiple machines. Outpatient, you got one machine and it's constant. So I personally think a hospital is not as stressful or busy, in my opinion. Now, do you have heavier and harder cases? Most likely in the hospital, but that's okay. You're not being rushed. And 3 days a week, I like working 3 days a week. I do not like working 5 days. I think I've had one radiology job that was 5 days, and I did that for 2 years. I was a manager, and I was like, yeah, not just for the birds. I didn't get into healthcare to work 5 days a week. But 3 days a week is amazing. Yes, it is absolutely amazing. I got a good question here. Do you think ARMRIT is worth it? Armorit. That is a certification board, excuse me, a certifying board like the ARRT. Do I think it's worth it? It is shown to be credible, and many places do accept. They do accept Armorit more and more now. Back a few years ago, some years ago, in the East Coast, they did not accept it. Hospitals did not recognize it. It was pretty new, and they had to prove themselves that they were actually not just letting people pay to pass. And that's what happens sometimes with some of these new places, new certifications, new governing bodies and things that pop up. They don't want to follow all the rules. So like certain schools that come up, there are schools that pop up for radiology and they just want to get the money in, and they know there are people out there that'll pay to get a quick job. So they don't follow the rules, and that's why they don't keep their accreditation. That's why they close down after taking people's money and people can't graduate. So Armor It is worth it because, I mean, they've proven themselves that they put out quality students and people actually have to pass a real exam. It's not a pay to pass kind of exam. And their technologists have proven themselves that they are competent. Now, if you do Armor It, you're usually only an MRI technologist, which means you went to a program that was MRI only. Some people, that's what they want to do. Nothing wrong with it. It's a primary pathway, just like radiology is. Only difference is after you do the MRI Armor It, your education course has to have follow the ARRT curriculum for you to now go say, I want to take the ARRT exam. And that's what many people do. They have the Armor It and the ARRT exam. So, it's nothing wrong with having both. Sometimes you have to get in how you got to get in, right? And that's how some people choose to get in. So great question. How much time? Got another question. Kiki, you are coming with the questions. Thank you. How much time do they give you to scan each patient? Woo. So somebody answered probably 30-minute slots. Child, no. I wish those days. I think the last time I had 30-minute slots for MRI scans at an outpatient, even at a hospital, were probably in 2013, 2012, something like that. It's been a long time. You got to have a double study for 30-minute slots, or you got to have a department that doesn't know any better. Your manager probably just don't know any better if they giving y'all 30-minute slots, because a manager at an outpatient, they trying to make money. You're going to get 20 minutes, maybe 15 usually. They will get it down to a science. They'll say a C-spine in the brain only takes 15 minutes. They don't account for the time it takes to get the patient on the table. They don't account for the time it takes to work claustrophobia out and get the patient relaxed. That is not calculated into that time. Contrast, they'll add a few more minutes onto it, but yeah, no. 30 minutes is like an abdomen's time, and that's abdomen with contrast. Yeah, so you gotta be, working at outpatient. The other thing is you have to be very self-sufficient. You have to really be able to hold your own, because a lot of times you are working by yourself. And okay, there's another question. You're working by yourself. You have to know how to put in IVs, because a lot of times there's nobody there, maybe just one other person besides you that could do IVs. And not just put in IVs, you have to be proficient at it where you do not miss. Because if you miss and can't get IV access every time the abdomen comes, that's money the department loses. And they're not going to be very happy with that. So you want to make sure that, you can, and you want to be able to handle emergency situations, because a lot of times at outpatient centers, you don't have the code team. I mean, not a lot of times, any of the time. You have to call 911. Because most doctors, they are not equipped to handle emergency situations like that. They're usually surgeons or family practice doctors. They're not emergency room doctors. They're not a med team, EMT or anything like that. So paramedic. So that's what I would say. So yes, that's what I'm doing. I plan on taking both of them. Yeah. Why not? If you can take both, take both. It doesn't hurt, because there are some jobs, not just hospital jobs, they only accept ARRT. And that's what it is. Yeah, somebody said, oh, well, it's fast paced. Oh, yeah, outpatient is not sit back and chill. Mm-mm. It's not sit back and chill. I would definitely tell you that. It is not. If you find a job where you learn, once you learn how to pace, your environment. Like for me, when I work at any job, I have my system, and that's how I do it. I make sure that I have a system of how the paperwork goes. The patient come back if they got. I mean, I can have 3 patients back there and get this CT over here drinking while I do this MRI because I know how long this MRI is going to take, and this CT. I know how long it's going to take this person to drink, so I'll stagger those CT patients to drink it. So that way, when I'm done with this long MRI, I got these 3 abdomens, and I load that injector up. Everybody got their IV already in. Finish the MRI. They're out there waiting on their CD, getting undressed. I bring that CT in the room. We at least get that without done. Da, 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 bring them their CT. They're done. Have a good job. Your CD. Have a good day. Your doctor be with you in 24 to 48 hours with the results. Come back in. Finish my CT patient, inject that contrast, go in, make sure it's no extravasation, make sure no reaction, boom, 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 all done. Next one, roll on in and roll. I mean, you gotta have a system when you're working outpatient because it's just you. It's just you, and things happen. You have to be able to hold your own, think on your feet, catch doctors' mistakes. I used to work at a place where sometimes a doctor would just order a chest, a high-res chest. They really wanted to order a PE study. A high-res and a PE study, which is a pulmonary embolism. You're looking for a pulmonary embolism. That's two different, totally different scans. Or they'll just order a chest without PE protocol. A pulmonary embolism protocol needs contrast. So you got to catch those things. Unfortunately, even doctors don't know about radiology. They rely upon us to really, outpatient and in the hospital, they rely upon you to know what you're doing. And it's important that you do understand that, oh, this is not going to be the test this patient needs. They need an interrogatory. They don't just need a routine abdomen pelvis without there. This is Crohn's. They need this and that, or this is a hematuria protocol for CT, not just a regular kidney stone protocol. They've been a hematuria protocol. So now you got to give contrast. You have to drink water, however your facility does the hematuria protocol. You have to scan from this to the pubis. It's different. Every diagnosis that you're trying to gain, that scan is going to be different. So, question, private user says, my biggest fear is the screening patients due to safety stuff. As long as you follow your facility screening form, do not fill it out for a patient. Don't sign it for a patient. Don't go down and just check no. If the person can carry that cell phone and talk on the cell phone, if they can carry that big pocketbook, they can fill out their own form. I just tell you that to tell you that. It's a legal binding form. Patients or their medical personnel need to do it. And if there's nobody there for them to do it, the hospital has protocols to where you and another technologist or you and a radiologist sign off on that screening form. And the radiologist takes the responsibility of making sure that patient does not have any metal in their body. But you do not fill out forms for patients. They need to, and some people just don't like to fill out stuff. I mean, I dealt with the population. A lot of them were illiterate and didn't read very well. So I could understand it's embarrassing for them to say, well, I can't read, so I can't fill this out. You kind of figure out, got a hair going across my face, sorry. You kind of figure out that people aren't filling it out because they have some reading limitations. So you don't want to embarrass them. So when you're working with certain populations, you realize ways of making sure that you still follow the legal parameters. Maybe they bring somebody and let that person fill it out for them, or you sit with them and you say, well, I just need you to sign something here. You just sign. I don't care if you can't spell your name. You just sign something. So that way it's not your signature, if that makes sense. But as long as if you question it and if you're not sure about it, it is nothing wrong with you saying, hey, doc, I don't know this. Or find another technologist that has more experience and ask them. Sometimes when I work at places, I'm like, I don't always remember and there's a website you can go to. We have a book too, but MR safety book, but there's a website. You just go there and you could type it in or look up that implant. And this is the other thing. If people don't have an implant card, they can't get scanned. You let the radiologist say they can get scanned, but the answer is no. Don't go against the protocols. You'll always be safe. How long did it take you to get used to screening patients alone? Oh, pretty quick. we learned on the job. Back when I did MRI, we didn't have schools. You had a little book that somebody sold, a company sold, and you took that. But I literally read the MRI practice book. That's what was my study guide. I read the MRI practice book. I took a course after I took the MRI registry and I failed it. I made like a 73, 72, something like that. Devastated because I took it 3 times. The first time, I will have the courage one day. If y'all could get me a lot more watch hours, I'm gonna say if I can get, I'll let you know. If y'all can get me to, once y'all get me to these watch hours, I am gonna tell this highly embarrassing story of how I failed my MRI registry the first time. Y'all can't even guess. Nobody in the world would be able to guess how I failed it. It's something that I think I am the only one who has ever done. I'm laughing now, but literally had a whole meltdown. Whole meltdown. Yeah, it was bad. It was bad. Yeah. Oh, good gracious. Well, I am going to tell that story, but that's one of those stories that we're gonna have a big celebration for me to tell that story because it's highly embarrassing. You would not be able to guess how I felt it. I could promise you there would be not one person on this earth that could figure out how I failed that test. I wouldn't even give myself credit enough to fail that test like that. That was awful. So literally the third time I went and found someone and somebody felt so bad for me the way I failed it the first time that they heard that I only had one more time to take it, and they told me about this course that was coming to this hospital, and he charged $100 for it, and I was like, "Yeah, I'll pay 100." She said, "Okay, they don't have many seats left. I need you to send me the money. Here, honey, here's the money." I don't know how. I think I mailed her a check. That's how long ago it was. I mailed a check. We didn't have Zelle and all that stuff, so I mailed the check. Went and sat my behind in that seat Saturday. I think it was Saturday, all day Saturday. It might have been Saturday and Sunday. I just actually found. I got to show y'all a lot of stuff. I'm gonna one day do like a video and show all the stuff I just found from my school. I found my graduation program. This is my tassel. I used to hang this in my SUV I gave to my brother. I had a Toyota 4Runner. It was the first car that I bought after graduation. And this is a tassel off of my hat. I don't have my graduation gown or hat anymore. I I remember getting rid of those, but I kept the tassel in my degree, and evidently I kept the plaque. So I got all of that, and then I found the program. I don't have any pictures. My friends took pictures of me, but I don't. He went to radiology school too, and he came to graduation. Him and his fiance, and I know they took pictures, but I'm gonna have to text them. You got any pictures of me at my graduation? My mama don't take pictures, y'all, so she don't have any pictures. Oh, and my dad takes pictures, but he didn't have it either. I went through all this stuff and I didn't see any of my graduation pictures. So who knows? But my dad is big on taking pictures. My mom just is not. So, and I'm big on taking pictures. So I get that from my dad. What are some mistakes? Come with it, Kiki. I know that's what I'm talking about. Private user and Kiki, y'all are just blowing up this chat. What are some mistakes you made early on in your career? Not not applying for radiation therapy again. I wouldn't call it a mistake, and I wouldn't call it a regret because I'm very happy with the trajectory of my career. I'm very satisfied, very happy, and I still got time to do it again. It's just, do I want to? Because I'm at a point in my career where I make enough money. It's not about the money anymore. Um, and I know what I know, and I've learned, I know a lot of things in this profession, and I'm very confident and comfortable. Um, so do I want to go back to school is the question and learn another modality? That's it's just, if I do, it has to be something that I can see myself doing into retirement. So that's really the only thing I would say. I wish that I would have applied again for radiation therapy, because if I did and I was doing radiation therapy after MRI, MRI and radiation therapy now mix. They're bringing the two together. And then I would be able to do medical dosimetry, which is something I always wanted to do. I just honestly don't like trigonometry and calculus. I can do them, but it take a lot of brain power for me to do trigonometry. I struggled in high school on trig. I made a C, and that was a bare C. I barely made that C. That was rough. I had tutoring the entire time for trigonometry. I had a good teacher for algebra. That was fine. Geometry, I didn't like that much, but it didn't make sense. I mean, nothing but a math with my money makes sense. But you really need those things in medical dosimetry. The angulations you need to know, but I really enjoyed radiation therapy. It was amazing. It was really good. So I could see going back for that and mixing that in with the MRI, the experience that I have with MRI, and maybe later on going for medical dosimetry. So good question. That's me taking a new test, LOL. At this point, I'm so busy and trying to work and, just enjoy my life. Do I want to devote Monday through Friday to going back to school? That's my biggest thing. Is honestly, the answer is no. I don't, especially when it's not going to set me further ahead monetary wise. If I go back to school for something without it being medical dosimetry, it's not going to make me more money. I think it will set me back. And do I want to give up 5 days a week for the next year to make less money? I mean, that you just have to weigh things out, especially when you've been doing something for so long. It's like, but when you're younger, I wish I would have got a certification every year or two, to be honest with you. And this gentleman told me that he was like, get a certification every 2 years and use that as your CE credits. And I was like, but I don't want to do he said, I don't care if you don't want to do them. Just get one every 2 years and put those letters behind your name. That man was not lying. He was exactly right. So I'm going to say that's what I wish I would have done, was every 2 years, get a certification. In 22 years, I think I would have had about all of them. So I wish I would have done that. Good question. Have I ever felt pressure from doctors or nurses to do a scan against safety protocols? Not from nurses, because they don't tell us what to do in our department. Nurses have no authority in our department. Doctors from the ER, radiologists, cardiologists, pulmonologists, we work with them a lot. They can come down and tell us. So have I ever had any pressure? Yes. I remember one time in particular, I was working at night at a facility, and this ER doctor was upset that I had not called over his patient to get it. Why did I call the radiologist? Because the way I handle things, it's not my place, and I don't have the authority to tell a doctor I'm not going to do their scan. That's not. But if I feel that something is questionable, it's my duty to let the radiologist know, because the radiologist is responsible for the radiology department. They are the medical directors over that, not an ER doctor and not any other doctor. Our doctors are the radiologists. So we watch their back and they got our back most of the time. And I called him and he said, oh yeah, no, I need to call him and ask, why are we doing this pregnant patient for, I mean, it wasn't like he could do surgery on her for what he was looking for. I'm not going to divulge what it was, but it wasn't emergent. There were other things like an ultrasound that could have been done versus an MRI. And this girl was extremely pregnant, and I used to scan fetal MRIs at a children's hospital for years. Most people don't make it through a scan when they have healthy babies. Babies that are in utero that are not really active or living well, when we do fetal MRIs, the baby is usually in trouble, or babies are in trouble. Either they're conjoined, there's some deformity. They need to see how viable the pregnancy is. What are they expecting once this baby is delivered? That's why we do fetal MRIs at children's hospitals a lot of time. They're usually a problem. And those babies aren't usually that active because they're really sick in utero. Those babies are usually really, really sick. So getting them to move, which we want to get them moved, is like a job. And that scanner cranks up so much noise that those sick babies in utero, they still don't really move. So the mother can make it through a lot of the scans because the baby really isn't active. So, but an active, healthy baby in the stomach, when you put them in the scanner, they are somersaulting inside of that poor woman, jumping from and it's no scientific proof that it hurts them when it's past a certain trimester. But when I tell you how active that baby gets, and the women start sweating so bad, it raised their heart. They just can't take it. And most of them, after 2 sequences, they buzz us and tell us stop. And this lady didn't speak English. So she didn't know what this doctor wanted to do. And I could not, in good conscience, just lay her on the table with, we can't speak even if we speak the language, we cannot speak medical languages to people that are not our first language and not medically certified to speak that language. And I'm not medically certified, and I don't speak Spanish anywhere near where I can be certified. And I just felt like somebody needed to tell her what was going on. And she could tell by my face that I'm not. So the radiologist was like, no, he needs to have a language line come in here and explain to her. And out. So radiologist basically told him no. So he came over to me to bully me and tell me that I was wrong. And I was like, well, you're talking to the wrong person. Well, I want this scan to, again, you're talking to the wrong person. And I'm gonna ask you to take your tone down. You just don't talk to people like that. And he was like, well, I don't see the problem. I said, if you can speak to that lady to where, because she is questioning it, and I don't speak Spanish like that, and I can't speak back to her in Spanish. Did you have a translator talk to her? Well, because it was nighttime, they didn't have a translator. They had to call. This was a small hospital. They had to call the line, the language line. They were on hold. They really didn't want to pay for it. It was a whole other thing. And I was like, well, the radiologist said no. Eventually, they got the language line on, and they talked to her husband. He finally picked the phone up. They talked to him, and they said, okay, the radiologist said, as long as she understands, and she got through maybe one sequence. When I say this lady was so pregnant, I thought she was going to go into labor. That's how pregnant she was. That woman was sweating so bad. She was so hot. That baby she was like, oh, I thought she was about to go into labor. I had to have them come check her before I sent her back into the rotation to go transport it. I didn't want her going into labor during transport. So yeah, you have to, as a technologist, just really hold your own. Don't let anybody pressure you into doing something that you know is questionable or you don't have full understanding of it. It might not be wrong, but if you don't totally understand it, don't do it. Go to your superior and let them make the decision. And it's plenty of people there that if you don't feel comfortable scanning it, you can have somebody else scan it. So, but always communicate, just don't refuse. Hate math. I hate math. Yeah, certain maths, they're just not my jam. Or I just need to get back into them. Because if you've been out of practice for a while with trigonometry and calculus and algebra, you got to kind of get some tutoring. So, and that sure is what I would do. Radiation therapy sounds like it's emotionally taxing. It can be. It really can be. You get attached to people because you have them for their period of treatment time. So most people go to radiation therapy. Like my aunt went for radiation therapy with breast cancer, and she was there for 12 weeks. And you see them come in, and they look like themselves. And sometimes at the end of treatment, they don't look like themselves anymore. They have bad days, very weak days. Some days they don't even come because they're so weak they can't even make it to treatment. And you wonder, will you see them the next week? And then when they pop up, all energetic but weak, you like, they made it another week. It is very taxing because you get to know the family, you get to know the person. And not just radiation therapy, even as a CT technologist, I worked at a cancer center. That was one of my early jobs. And it taught me a lot. It taught me not to judge anybody because we had so many people come through with lung cancer and they were never smokers. They just worked in office buildings. But, back in the day, people worked in buildings that had asbestos and many other pollutants that they breathed in every day. And these people, you would give them every 6 months their CAT scan because they had to come in every 6 months for a follow-up CAT scan to make sure they didn't have a relapse. And these poor folks, they know they're not going to make it. They're just so weak. Or you see, even with MRI, you see patients, when I was doing breast MRIs, you see patients come in and they're 19 years old with a golf ball size tumor in their breast, and you just know, and they know. You see them with these little kids, and it's like, oh my goodness. Like, how did they get that big? Why, just people are, people don't have access, and sometimes people are afraid to go to doctors, and it's too late, and you just start thinking about, man, that could be my little sister, that could have been me. That it is definitely very taxing working in healthcare, and that's why I tell people radiology is not a button pushing job. it is definitely a profession where you get attached. Our patients just don't come in and come out, come in. I had a nurse friend say, if I would do it all over again, I'd go for radiology. Y'all don't have, what did she say? Y'all don't have to deal with patients like we do. And that's just what my face did. Like, excuse me? Like, how do you know, first of all, we actually get patients in and we have to do this exact test on them that we do on everybody. And we got to make it look like textbook, but each patient is not the same and doesn't present with the same issues. But yet we are tasked with making sure the same result comes and the protection to the patient. And we still have to do things like put in IVs and dose patients and biopsies. And yeah, I'm gonna tell you, this is an amazing profession with options. So if you're in school for it, congratulations. If you're thinking about it, come on board. Hope my videos help. I appreciate you guys supporting me here. This has been a really good live. I did not expect to go this long. I appreciate the support. Let me just say that now. I appreciate the support of you guys being on here in the chat. And I will be doing this more often. I truly appreciate it. I'm always nervous to do lives because you hate to talk to yourself. But I'm the kind that's going to show up anyway. This is what I'm doing. This is something I want to do into retirement, which is create radiology content that is relatable and helpful, not only to the patients out there, but to those of us inside the profession and those that are coming into the profession. My goal is to not just create viral content, but it is to create content that educates, empowers, and is informative, and really helps people to do better than what I did when I came into the profession. I've been happy with where I'm at and where I'm going, but if I would have known more and known certain things, I definitely would have done things a lot faster and a lot more things. So I hope that's helpful. So back to the questions. I'm a student right now that's learning on Siemens Solus. Is there a huge difference between machines? Yeah, there's a big difference in machines. But Siemens is the popular gal out there now. I remember my first Siemens scanner was like 2006. I went into a job, and back in the day, GE ran everything. Everything was a GE or Philips. Philips was up north. GE was down south, and out west, they took over everything. And I would tell you, nobody would take this job. And I was like, he was paying good. I said, yeah, I'll take this right around the corner from my house. Yeah, I'll take it. He said, oh, it's a GE scanner. I walk in there, it's a Siemens. I had never worked on a Siemens CT scanner before. I didn't even know how to turn it on. I'm sitting there looking. It's an actual computer system. Unlike other scanners, you got breakers on other scanners you have to turn on. It's an actual, the machine you got to turn on. But for Siemens, it's like a Windows-based program. It took me an hour to turn it on, and I had nobody to call to ask because nobody had worked on the Siemens back in those days. It was brand spanking new. This was the first hospital in the metropolitan area to have a Siemens scanner. Oh my goodness. But I finally got it on and finally got that ER patient on the table. The scan was actually, I took so many scouts because I didn't know how to operate the machine. I never worked on it before, so I just fumbled my way through it, and it took me about an hour to do a brain without. So, but once I got it, y'all, I was on it. But I do like Siemens. GE is my advice is to learn every scanner. Don't go to the same clinical site because they got a Siemens. You just want to stay on Siemens. You will be more marketable when you know every machine. I could sit on any machine and scan because I have the basic principles of all of them. Now the software is going to change, but that's okay. When you know it, you know it. And that's the best advice I can give you. Do you see a lot of gory stuff in general X-ray? When I was doing general X-ray, I did see, but I think it was where I worked. I worked in a place that was kind of inner city, and we had a lot of construction accidents. So you get the limbs half on, half off. You get the gunshot wounds. I've seen it all. You get chest wounds, stab wounds. You get people with gangrenous toes, and they say, well, I don't know why my doctor sent me here. My foot hurt. And they take off their sock, and you get the smell, and then his toe falls and rolls. I'm telling you, it's rather interesting. It's rather interesting, but those are the things we see. That's healthcare. healthcare. That's radiology. I mean, it can get gory. I mean, you're doing X-rays while people have just, you're in an OR. That can be depending on what the body part is and who the surgeon is. It can be gory as well. You're welcome. Thank you for asking the questions. I really appreciate it. Thank you so much. You guys, it has been an hour and a half that I have been on here. I want to say thank you to everyone. I appreciate your support for this live and for all of my content. If you haven't checked out my podcast, A Couple of Rad Techs podcasts, please be sure to check it out. You will love it. I am sure of that. I enjoy making it, and suggest any topics that you want me to make videos on. Please, you can send me a DM on Instagram. Oh, you're from Portugal. Welcome. Oh my goodness. Welcome. Portugal. So thank you, Danny. So you guys can check my podcast out. It is on all platforms, A Couple of Rad Techs podcast. It is also here on YouTube on the playlist, A Couple of Rad Techs. And thanks so much.